Well, first of all, I want to mention that you see
Sure.
pediatrics.
Right.
So then we'll go from there.
Okay.
Common, I guess, injuries. Okay. Okay. Dr. Lager, do you only see adults or do you see kids as well?
Oh, we treat pediatric patients as well. I love kids. I love kids. A lot of doctors are scared of kids, and I understand. It can be scary, but we take care of them, and they're great. And on the playground, or in sports, or just in life, kids unfortunately may get injured. And I really love seeing the children, and we make that a very important part of our practice. Some doctors are adults only, but we take care of children. I don't do any pediatric deformity. I think that's really left to a specialist, so clubfoot or claw hand or some other types of syndromes that you'll find at birth. I think those are best left to those experts. But everyday life fractures, particularly sports injuries, ACL reconstructions were shunned in the orthopedic community for a really long time. It gets to be a little bit complex, particularly with an ACL, because children's growth plates are open, and the way in which you generally reconstruct an ACL is by drilling tunnels right through the growth plates. And in some instances, the growth plates will then close prematurely, and it's just awful because one leg on the child will continue to grow normally and the other one won't. So there are some specific techniques that allow us to spare the growth plate, which is what I use whenever I find a child that has an ACL that's torn that requires reconstruction. For a really long time, orthopedic surgeons wouldn't even touch it. They would just tell a very active 8-year-old who's the best in their little league or the best in Pop Warner football to just sit on the sidelines until they're 14 or 15 and their growth plate's closed. And that sounds nice, except when that's your child or that's you, and sports are a huge part of your life. So I try to keep that in mind when I'm treating patients. I think it's very important to understand who they are and what they do and what sports they enjoy playing, so that at least I can understand what's important to them and work with the parents and work with the children to try to put together a really good treatment plan that meets all of their goals. You doing all right?